Sorry.
Oh, dearie me.
Somebody's going to be looking after you.
Thank you.
We are back with the West Midlands Ambulance Service
We got a job.
as the paramedics take us to the heart of the action once more.
He's currently having a seizure in the back of the ambulance.
We're going to be all right. We're going to be all right.
Old friends are back on shift in Dudley.
We see everything from life to death and everything in between.
We do.
And for the very first time,
We're in and we're online.
we're taking you to Stoke,
This is where it's all going to kick off today.
where new crews face fresh challenges
Oh, you kidding me? Oh, they're gonna be horrible.
and experience heart-pounding action.
Grab the kit, grab the kit.
Body-mounted cameras record every moment,
What's that?
showing you what goes on behind closed doors.
Still struggling quite a bit, aren't you?
Well done, you.
Don't shoot me. I'll try not to.
This is a paramedic's eye view of life on the road as they battle over 4,000 calls each day.
You need to keep very still.
Am I alive?
I think you're alive.
Okay.
You'll be on the front line with them as we take you inside the ambulance.
That's what I love about this job, though. You never know where you're going to go, do you?
Right, is everybody ready?
Glasses down.
That's when you mean business, when the glasses are down.
I'm on it today.
You are on fire.
Fed up of hearing sirens now.
What else would you be doing on your Monday morning?
What time is it? 12 minutes past 10. Sat at home drinking a cup of tea, watching Jeremy Kyle.
It's a Sunday afternoon in Dudley. Regular crewmates Joe Stevens and Ash Bolus have known each other for nearly 2 years.
I can't get in.
She can.
Ash is a technician and is 4 months away from completing his paramedic training.
Where are your feet?
At the moment, out the door.
Do you have it right the way back?
Yes, I have to. I've got long legs.
Joe qualified 7 months ago.
Right, are you ready? You still can't touch the floor.
They've just been called to their next job.
55-year-old male, having difficulty in breathing, fighting for breath, sudden onset, and some chest and upper back pain.
The job has come in as a Category 2, which means there could be a risk to life. The aim is to get to a Cat 2 within 16 minutes. Joe and Ash are there in 8.
That sounds like our patient.
Hello.
Hello.
The patient's wife Usha called 999 when her husband Satnam's chronic cough suddenly worsened.
What's been going on?
You just popping it on and wheezing and chest pain.
How long have you had it for?
It's been like 1 year.
Pop your finger in it.
That's just worse, isn't it?
Okay, there we go. Has he seen a doctor about it?
Yeah, we see consultants.
Has he on any medication for it?
He's only got this one.
Prednisolone. When was he given that?
2 weeks.
All right.
2 weeks ago. Hello, sir. Is it okay if I have a quick listen to your chest? Yeah. Try and take some nice deep breaths for me if you can.
Is he allergic to anything at all? No. Has he had an episode like this before? Not like this.
So he's been like this for how long? Okay.
That just happened today.
Yeah.
Like out of that. And he got the cough for a long time.
For a long
They were
time.
saying it's acid reflux.
36.
Before anything else, Joe wants to open up Satnam's airways.
What we're going to do is we're going to pop a mask on. It's a nebuliser, okay? Give you something to try and help with your breathing a little bit, all right? Are you coughing anything up? Any phlegm? Yeah. And what colour is it? Red. Okay. Okay. So when you're not coughing this hard, are you still producing anything? Any phlegm?
It's like watery.
It's watery. Is it clear in colour? Yellow, green? It's clear. Okay. Have you got any heart problems? None at all. Any other medical problems? No. Try and relax for us, okay? I know it's quite scary when you're having difficulty in breathing, all right? But try not to force the coughing out, okay? Have you got any pain at the moment? Okay. Is that pain started with your coughing? Yeah. And does that pain get worse if you take a deep breath in? Stays the same. Let the medicine start working, all right? That's it. How long altogether have you noticed the changes in your phlegm?
In a while.
A while?
Yeah, but it's gone worse now.
The nebulizer should be easing Satnam's cough by now. Joe needs to know more about his condition to decide the best treatment.
Have a spot of blood out your finger, sir. Okay, nice and relaxed.
So when did he start the prednisolone again, sorry? 2 weeks ago. And have you had a recent chest infection?
Because we are consultant, because he went to see the ENT one.
Did they give you any inhalers?
Yeah, but I do travel, it didn't work.
You've not recently travelled anywhere, have you? No? What do you do for work?
Works at Morrison's.
Morrison's. There we go. Nice deep breaths, okay? When you're talking to me, your breathing's a lot better. And the fact that you're able to talk to me in full sentences is a good thing, all right? So we've just got to try and get the anxiety under control a little bit, okay? Unfortunately, the nebuliser therapy wasn't working and Satnam was obviously becoming more distressed. Although we can obviously see that there's a problem, we can't show that to our patient because we're there to reassure them, we're there to make sure that they're going to be okay and get them into hospital on time. Okay? We need to get that investigated further. Try and relax for us a second. We just need to get this trace in your heart, okay? Just have another quick listen. There's quite a lot going on in there.
Crackles or?
Rails, wheezes, crackles.
A lot.
Everything. Would you mind if I tried to pop a needle in your hand? Is that okay? Yeah? It's just in case these don't work, all right, and I have to give you some other medication, okay? Just relax, that's it. Right, there's going to be a sharp scratch, okay? Nice and still for me. Right, when we can, we need you on the chair if that's all right. Okay?
On board the ambulance, Satnam's showing no improvement. The crew decide to give him intravenous steroids, which are stronger and act faster than a nebulizer.
What we're going to do is we're going to give you another medication through a needle in your vein, all right? And hopefully it can start to ease that breathing a little bit more, okay? Because you've had a couple of nebulizers now, and you're still struggling quite a bit, aren't you?
You're doing brilliantly.
Right, just going to pop this through the little needle here, all right? Got to give it slowly over 2 minutes, okay?
Ready? Starting time.
Okay.
Is that Sandwell? Hello, Sandwell. Can we pass you an alert, please? 55-year-old male. Difficulty in breathing. He's having nebulizers back to back. Increase in coughing. He's normally fit and well. GCS of 15. He's cannulated. We're giving hydrocortisone. Perfect, lovely.
How's that feel now? A little bit better.
Happy, Joe?
Yeah. All right. Try and reduce that breathing. We've got another nebuliser I can give you again in a couple of minutes, all right? We're going on blue lights and sirens just so we get you to see a doctor straight away rather than waiting, okay? How's that feeling? Better?
As they arrive, despite the steroids, Satnam's cough is as bad as ever.
I'll probably do a chest x-ray and some blood tests when you get in, all right, and see what's going on. There we go.
Right then, sweet, if you can come and jump off first for me. The problem that we had was the fact that normally when you give salbutamol, you see an effect, don't you?
Yeah. If there was any infections or asthma or things like that, you'd see an improvement, wouldn't you?
Yeah, 2 weeks of steroids and inhalers that don't work, and it's got worse.
I hope they get some answers soon.
Has your girlfriend got any new horses?
She didn't have one at the moment.
No.
No. Hers died. He was 27 though, so he was a good age, bless him.
Is that the one that tried to kick you?
Yeah, on many occasions.
Does she want another one?
She'd take a horse over me.
Yeah, my best mate and his missus, they sort of track each other and see where they are. Not for, you know, anything dodge, but just to see where they are. And I told my mum about it, and she was like, "Oh, that's not good. That's not good. There's no trust there, is there?
No.
You can't be spying on your other half."
No.
And then both my mum and dad got iPhones and instantly turned the function on and started spying. She was going, "Oh, look, your dad's in Knutsford." He's always bloody there.
In Stoke, ambulance crewmates Joel Mullen
Hi here.
and Nick Griffiths have just begun a 12-hour shift.
These uniforms are not made for hot weather.
We'd rather like polo shirts, wouldn't we?
I think it's the trousers though.
The trousers.
So
You'd
thick.
rather just shorts, like postman shorts.
Joel worked on a dairy farm before starting with West Midlands Ambulance Service.
Do you think you could really like pull off shorts with like your boots?
Oh God, yeah. I used to go to school with short black skirts and Doc Martens on.
Did you?
Oh wow.
What do you like?
Amongst other jobs, Nick used to be a swimming teacher.
I had a dream last night. I was back at school actually. That's why.
Did you?
Yeah.
How long ago was that?
Not that long ago. Cheeky.
The pair get details through about their next patient.
So, Mr. Brian, he's fallen approximately 6 foot from ladder. Patient's fallen onto his back. He had hit his head as well, and he appears confused.
A fall from that height could have caused major injuries.
Oh. 674.
7-4, just to let you know where trauma death jabs looked in the case. If you do need anyone else, that's it.
Yeah, roger that. We'll let you know as soon as we get there, thanks.
To get to Brian's house, they have to drive along busy country roads, which present an extra challenge.
He's mounting that there. What? I wouldn't have put my car up there, no that much. Yeah, good job, thank you.
It takes the crew 15 minutes to get there.
We've got a waiver.
We've got a waiver.
We've got a waiver.
Very helpful for us.
Yeah. That's a nice pink top as
Oh,
well.
he's out in the front here. He's
Is he?
on his back, bless him.
67-year-old Brian was on a stepladder using a hedge trimmer when he fell. His wife and a neighbour have been looking after him till the ambulance arrives.
Hello, Brian.
Hi, sweet.
My name's Joel. What's going on today?
I just fell off them steps, that's all.
What steps are you falling off of? Everyone's there.
Brian's wife Janet was trying to hold the ladder steady for him when he tumbled off.
I saw this part land first.
Right.
And it went on to the wood, and I looked at him, and he was out of it, and he was going like that.
Okay.
So I thought, I don't like the looks of you, and I'm going, Brian, and he wouldn't answer me, and his eyes were all over the place.
Their neighbour Debbie called for the ambulance.
Janet came over to get me. As I came out of my drive, he wasn't moving. He started to move as I crossed their lawn, and I made him lie back down again.
Okay.
So he hasn't moved since.
You haven't moved since? Okay. Have you got any pain at the minute, Brian? That left side?
He's tried to move twice.
Okay.
I've tried to keep him still.
Brian, bless him, he got a rickety old ladder on a very uneven surface. It was never going to end well. Sometimes if someone falls awkwardly or lands badly, moving them can be quite dangerous and can actually worsen the initial injury. So keeping them still was the best that it could do for Brian.
When I fell, the ladder's ripped the wrong way, and I just hit my side on the side of the ladder, that's all. Like,
Okay.
But
Tell me if you get any pain anywhere.
Nah, that's all right.
Take a big deep breath for me. Does that hurt? Just this left
Yeah,
side?
you look like that hurt a
You look
bit,
like you're in pain.
to be fair.
Can I lift your top up here?
Yeah, but I have rheumatoid arthritis.
Have you?
Right,
Got
where does that
arthritis.
affect your body the most? Everywhere, it's not isolated, you've got it everywhere.
Right, I'm just going to listen to your chest while you're lying there, okay?
Good
Just
work.
relax that arm for me, okay?
Well, you must have something better to do.
No, nothing better to do today. You're the first one of the day today, Brian.
Really?
Yeah, first one. You're the lucky man. How do you feel about just sitting upright for me, just to start with?
Yeah.
Just,
If anything
if I can get
hurts or anything,
hurts at all,
just tell us.
Just tell us, all right? Just bend in the middle, okay?
Okey-doke.
Just bend in the middle for now.
That's fine.
Okay?
Yeah.
How you feeling?
Fine.
Right, stay there for me.
Everything okay in your neck?
Yeah, yeah.
Yeah,
No
you'll get a
pain
good
at all.
feeling all the way down and back.
When you take a deep, big breath in, does it hurt more?
A little bit, yes, it's all right.
Whereabouts is the pain whenever you breathe down? Down
Well,
that.
you only just say right at the side, that's all.
When we checked over Brian and we were happy that there was no other major concerns regarding his head, neck and spine, we were very aware that when he breathed in, he was getting quite acute pain down his left-hand side. Even though he was trying to hide it from us and make out that it was fine, we could tell by his, just looking at his face, he was in quite a lot of pain. I think it might be worth getting a photo of them ribs.
You think so? Mm. Do you just draw?
You can't really... Can't you just draw him?
Yeah, draw.
Brilliant, I've never heard that before. I love it. Just because, if anything else just broken a little bit, we don't want anything protruding on your lung. If it is just a straightforward break, there's not much they can do for it anyway, but it's worth getting a chest x-ray just to have a look that your lungs are all intact and fine. Shall we try the stand?
Yeah, well, we go for a stand up, Brian, will we?
Yeah.
You're struggling to bend them.
Where's,
that just age?
is that normal for you?
Okay.
See, this is what's difficult to assess you as well because of your normal pain.
Right.
Might be worth getting an x-ray.
You're tall, actually. You're not that tall down there.
I thought that. You must have bigger things to do. I'd be all right.
Brian, will
don't
you be
mind.
quiet? You're going to be checked because I've seen you.
I aren't arguing with it.
I wouldn't argue with her either.
Let's get you on the back of the truck then and then get you comfy and then...
Aye, come and have a seat, Brian.
If anything changes, any pain gets worse or anything, just let us know, okay?
Janet, this lovely seat is for you. Would you like me to take anything for you?
Thank you, Nick.
You can just...
I bought you a clean top, dear, when you had your x-ray.
We all okay?
Yeah, we're all good.
All belted up?
Yeah, I'm getting belted up now. Have you got any pain now that you're sitting there?
It's just
A little bit sore in the left-hand side. Yeah.
Though Brian's making light of his accident, Janet was there and saw how hard he fell.
Did you feel me touching your face, Brian? No. I was going, Brian? No. Yeah.
She's beat me up.
I've eaten you, aye. Poor Brian here, look at him shaking. It's because you're driving.
when we got there and he was lying, I thought, oh no.
Yeah, it was really rickety pair of ladders, wasn't it? I said to him on the way in he could do a new set.
And if he'd had the chainsaw as well.
I know. I think he dropped the chainsaw whenever he fell too, so if he'd landed on or something, he was going to be
so
scuppered.
lucky.
Yeah, he could have been a hell of a lot
Hopefully
worse.
it's just a bit of soft tissue damage and he's okay.
Yeah.
I think he was.
There's definitely a better way to come into this.
Gotta be a better way.
There is. This is not the road that we should have picked.
Oh, we're going down my favourite road.
What, Mincing Lane?
Mincing Lane.
You've got Mincing Lane, you've got Horn Lane, you've got Bell End.
Bell End.
But do you know there's no number 69 Bell End?
Isn't there?
No, there is
Why?
68 and 70.
Oh, yeah, I suppose.
Do you feel like the ambulance is just going to tip over?
Not when I'm behind the wheel of it, no.
It's early evening, and in Dudley, Darren Westwood is on shift with Steph J. The pair are good friends, both in and out of work.
It's been an early meal break, isn't it?
No.
2, 3, 4, no. I'm on, oh God, what shift am I on?
2 twos. See,
Two
you're as worse
twos.
as me. Just as bad as me.
I don't know what's going on.
Hodder.
Paramedic Darren has been in the ambulance service for 14 years.
Oh, leave me alone.
Steph qualified as a full paramedic just under a year ago.
I don't think I should have got up today. Hobber.
Their latest call is taking them across town.
Off to Tipton for a male who has had a tremor and been short of breath and had part of his lung removed for cancer. It sounds like quite a major operation.
Chest infection.
Possibly. Might be a chest infection.
To be fair, we don't know when that happened.
2 weeks ago, the lobectomy. So it could be a chest infection, could be post-operative infection.
Yeah.
Oh, he's 83.
83, that's an old guy to have a lobectomy.
Yeah. Oh, we're nearly there.
They soon arrive at their patient Thomas's house. The crew wear body-mounted cameras to record every moment.
There we go, into left, yeah.
Thomas's wife Jean and their 2 daughters are waiting.
Hello, Thomas. Oh, that's better. I can see you now. What's been happening, sweet?
Well, I came in here after my tea and the daughter and the mother was out there and I sat down, I felt a bit cold.
Yeah.
So I just ate in the part of it and all of a sudden I started breaking out in shakes.
Mhm.
And I mean shakes, I couldn't keep my legs still.
Just 2 weeks ago, Thomas had surgery to remove half of his right lung, a procedure called a lobectomy.
So where are your scars from the operation? Are they front or back?
On the side.
On the side. Could I have some? Okay. Okay, lovely. You've had no problems with the wound at all? Not been weeping or oozy? Not that you're aware of, no.
38-1. You've got an infection somewhere.
Yeah.
38-1.
A fever is a sign Thomas's body is fighting an infection. This can be very serious, even life-threatening, so soon after surgery.
Have you got much pain at the moment?
It just come on all of a sudden.
Have you had to give that pain a number? So 0's nothing at all. 10 would be like an operation without an anaesthetic.
Right.
Scratch, mate.
I should say around about 7.
About a 7. Okay. Just breathe for me a minute so I can have a listen to your lungs, all right? Sit nice and gentle. You've got a bit of a wheeze on your chest, so I'll give you a nebuliser, see if we can get that under control for you, okay?
Yeah.
Get you feeling a bit brighter.
Well, this Ventolin what I'm taking, what they told me at the hospital,
Yeah.
it's supposed to be the same thing as a nebuliser.
It is, so that's what we're going to give you now, and it's like 10 puffs of your inhaler all in one go in like a liquid form.
Thomas has obviously had a major surgery, it's called a lobectomy, to remove a lobe due to cancer. He's also got an infection setting, he's wheezing, shortness of breath, and he's actually breathing quite quickly and clammy as well. So this could have been a sign of pneumonia, And if that pneumonia got worse, it could lead to sepsis, which is a quite serious infection for somebody who's as vulnerable as he was.
How's that breathing feeling now?
How's your breathing now, Dad?
The breathing's been all right. I had breathing problems before I had the operation.
Yeah.
So now I'm going to have more breathing problems, so they've told me. Because they're having half my lungs.
You'll get, your body will adapt to that.
Yeah, definitely.
It's tight.
Yeah.
But has this medication we're giving you helped with your breathing? Does it feel a bit easier?
Oh yeah.
Your temperature's only 38.1, so it's not a massive temperature.
Oh, good.
So you're coping with it at the moment.
Right.
So it's going to be a case of up to hospital, course of antibiotics
I've got to
from
go
the
to
doctor.
hospital.
We'll nip you up there to see the doctor because I want them to have a look at your wounds and see if we've got to work out where the site of this infection is, whether it's in your chest or whether it's your wound.
Right.
So probably a blood test,
Right.
and then there'll be a course of antibiotics and home again probably tonight. So a couple of hours up there. How does that sound?
Oh, that's better than
Yeah.
stopping in if I can.
Fingers crossed not stopping in, but I can't promise you not. But as long as you behave yourself, then hopefully we're in and out.
Right.
And if it's in for a night and then out again, then that's not too bad, is it?
No.
Yeah? We just need to keep on top of this infection before it gets on top of you. Yeah?
Yeah.
If you'd done nothing, the infection would have took a hold of your body.
Oh, right.
So you've done the right thing by family calling us. We don't want to worry our patients at any point, but we were glad that Thomas's family did act quite quickly for him. That infection could have got quite serious quite quickly. So who's next of kin for you, Thomas?
My wife, Jean.
Jean. And how long have you and Jean been married?
57 years.
Wow! You said that without moving your lips, eh?
Right. One seat. Shuffle your bottom all the way to the back of the chair. Relax. How would you like your haircut today, sir?
I'll probably,
Short back inside.
probably will later on.
The one thing I don't want you to do is to help us, okay? So keep your arms in, let us do everything, yeah?
It's raining a bit outside, so...
Yeah.
Right.
Love you.
Yeah, and you.
All right then.
And I'll see you
Get you
later.
back out.
It's a bit windy,
Just a little bit.
With Thomas and wife Jean settled in the ambulance, it's time to get him to A&E.
Right, ready when you are, Wes?
Ready when I am?
Yeah.
I am ready.
Pop a seatbelt on as well. So where did you two meet?
Oh, is it work?
Oh, right.
Right down there.
Okay.
And I'd come out of the Navy.
Oh.
And went there, I was a fitter, and Jane
Yeah.
was working on the line. On the conveyor.
Oh, fabulous.
Yeah.
So was it love at first sight, or did you have to work on you a bit?
Fair sides. Yeah.
Oh, fabulous.
15 minutes later, the crew arrive at hospital.
So we're here, Thomas.
And we're here.
We are indeed.
The Judge's Hospital. I've been up and down here a few times.
Just a few nerves.
Yeah. Right then, Jean, if we can get you to jump down first. Once the ramp's down, we've had enough mischief tonight.
Just be careful, love.
Here, Thomas's infection will be investigated further.
So he's got the potential of actually being quite a poor chap. He was starting to flag on our sepsis tool, but I didn't want to alarm him and actually say that to him. So kind of quite careful what information I gave him, really.
To be
So
fair
it's not
to
worry
him, he was actually doing quite well for an 83-year-old bloke who's just had a low back.
He was doing fantastic. He did not look 83 at all.
Can't believe it's raining. I've put my washing out. I haven't brought a coat with me. I've got my yellow coat.
I brought mine, or it might fit you like a tent if you want it.
Oh, are you offering your coat to me?
I am.
That's so nice.
And I'll wear my florry jacket, or I just get wet. One of the two. I'm good either way.
At the ambulance hub in Stoke-on-Trent, Joel Mullen is back on shift.
I need to burp.
This time with Sam Smith. They've just finished their dinner break.
Maybe a bit sick, actually. Ate too much.
What did you have then?
Just pasta.
The pair are on the way to their next job.
It's cardiac chest pain for a 33-year-old female. She's sitting outside in her car.
It's unusual to get a cardiac call for someone so young.
Oh, there we go.
Their patient, Heather, was out for a meal when she suddenly became unwell. Her friends have been waiting with her for the ambulance to arrive.
Right, you're right. We're here for this lady. Hello.
Hey guys.
I've got chest pain, it's all over my back.
And when did that start?
Not long ago.
Not long ago.
And it's really bad this time. It happened yesterday,
Mm.
but it went.
Can I hold your wrist while you have a chat?
I left it. I
relax your
thought
arm
it
for me.
wasn't that bad,
Uh-huh.
and it's gone worse today.
How have you felt on your feet today?
A little bit dizzy and sickness.
Can we get your arm out of this hoodie, actually? Yeah. So does it hurt as you move?
Yeah, it's hurting my arm.
I like that. Is that in case you get annoyed with anybody, is it? Are you sure? There we go. Pop this around your arm, just relax your arm for me. Okay, what type of pain would you say? Is it like a stabbing pain, like a throbbing pain?
Throbbing pain yesterday, but this one was a stabbing pain today.
Okay, did it take your breath away at all, or?
It's just I can't breathe.
With the symptoms that Heather was describing to us, like pain in her chest and in her arm, sounded cardiac related. So we wanted to keep her nice and calm, but also get a full 12-lead ECG done, so get her on the back of the ambulance as soon as possible.
Because you're getting these pains in your chest, am I okay to stick some dots across your chest as well? Just have a look at your heart. So 2 just go in the centre and then under your left bust. Is that all right?
If we can get to it, yeah.
Stay nice and still. Pretend you're on a beach somewhere with a cold
I'm going
pint.
to Blackpool as it is.
There you go. Pretend you're in Blackpool with a cold pint in hand. Right, so just nice and still and quiet, and I'll get this sorted. Okay. Right. Good. First things first. You're still ticking.
See if you take a big deep breath in, massive deep breath. Does that make the pain worse?
Yeah.
Yeah. See if you push on.
Hey!
Is that sore? Yeah. Okay.
Ouch!
ECG looks normal.
Yeah.
Which is good. Your blood pressure's really good. All your checks actually are within normal ranges. However, you're saying you are getting this central chest pain. If used, we're taking you to hospital to get you checked.
Okay.
We can give you a spray under your tongue and an aspirin to chew on.
Yes,
See if that
please,
helps.
that'll do. Just do it till I get there.
Do it till you get there.
Yeah.
It might help. What are you doing up here?
Yeah. Bon
Panasia.
all you can eat.
Was it any good?
Yes. You should go.
I'm not surprised you got chest pain after
should go.
going in there and eating loads.
No, I was fine before I got there.
Yeah, see?
Now, did you ever get indigestion before?
Yeah.
Does it feel like indigestion pain? It does feel like indigestion pain.
Is the pain starting and going up a bit as well?
It's going over my back mainly.
Okay.
Over my back shoulder.
Does it feel like, as you take a breath in, it almost catches on your shoulder? As if someone jabs you on your shoulder just as you... Ooh,
Yeah.
you can feel it catching. Yeah, sounds like indigestion.
Like anybody who's gone to an all-you-can-eat Chinese, I mean, for me anyway, you get stuck in, and to have a bit of indigestion is probably about fair play.
Yeah.
However, because she'd said she'd had a bit of the chest pain the day before, and she was still getting this stabbing pain to the centre of her chest, it's not worth just ruling it out. So we'd rather err on the side of caution. So we give her a bit of pain relief for cardiac symptoms, because if it isn't that, then all it will do is just help with the pain anyway.
Have you ever had one of these sprays before under your tongue?
That's the first time.
What it does is it dilates all your blood vessels. It might give you a bit of a banging headache.
Okay.
Okay, but it does wear off relatively fast. That's it, close your mouth. Right. 2 halves of a tablet, which I broke by accident. There you
Yeah,
go.
I've noticed that.
Sit and chew on them.
Okay. Love yous. See you soon.
Always happy.
Heather's friend Matthew is coming with her to hospital, where she hopes her partner Mark will join them.
Are you engaged then?
Yeah.
Oh, congratulations. When's your big day?
I don't know yet. We've been engaged for about a month.
Do you think he's the chap for you?
Yeah, he's always there for me. Head night will be Blackpool for me.
Blackpool.
And I'll go to the Gaties because I sing.
You're the what, sorry?
I sing.
You sing?
Yeah.
What do you sing? What kind of music do you sing?
All sorts. Stand by your man.
So you're a bit of a power ballad girl?
Yeah, I'm more power ballads than anything else.
Stay With Me by Sam Smith.
Shut up!
Stay With Me by Sam Smith.
Do you know?
I do know that,
Because
actually.
that's Sam's second name, Heather.
Sam Smith.
Seriously?
I think you should, Heather. I think you should sing it to him.
No.
I'll join in if you want.
No.
With Heather distracted from her chest pain, she arrives at hospital in good spirits.
Right.
Well, I'm giving you 10 out of 10 because you're
10
so
out of
helpful.
10.
You are so helpful. Both of you are.
You don't want to give us 10 out of 10, otherwise we'll start getting big-headed.
No, you are 10 out of 10.
Why didn't you let her sing to you?
Because if someone sings to me better than I can sing, I get embarrassed.
Oh, yeah. But as Sam Smith, you'll
Exactly.
I highly doubt there's many people that can sing better than you. So yeah, you should have let her sing to you. Should have let her sing to you.
In Dudley, Laura Hickman and Vicky Brown are just starting their shift.
So, how big's this steak I owe you for tomorrow then? This big. This thick. If we find a butcher's, I can get a nice one like that last one. Only the best.
It's not long before their first job comes through.
And we're going to an unknown patient in their 70s, fall injury unknown. Fall injuries unknown, and then in the notes it says fall and head injury. I think she's got a head injury.
Their patient is 74-year-old Jennifer. She's being looked after by a relative, Nicola, and a friend, Joan.
Hello.
Hello.
Yeah, are you?
Yes, I'm fine.
Good. Someone else who isn't. Oh, you're not on the floor?
I've had a fall. Yeah, she was outside. What she's done is she walked up the slope of the lawn.
Yeah.
And she's come backwards.
Oh, bless you.
Blimey.
Oh, dear.
Found her head on the paving stones on the edge of the garden.
Oh, right.
Big lump here.
I'm not surprised you've got a lump, my sweetheart, if you've fallen backwards, bless you. Did you knock yourself out at all?
Yeah, I think I did, yes.
I think you did.
Yeah.
You've got a nice egg, haven't you?
We go out a lot to elderly patients who have fallen over. Jennifer did take quite a tumble and had a nice bang to the head. The thing is with falls, it's working out whether it's just a bump to the head or whether there's something more sinister going on underneath.
Do you know when you banged your head, Jennifer, what was it off, like a rock or a drain, or was it off the grass? Like off the...
My head went across the curbstones.
Oh, your head hit the curbstones?
Yeah, the back block at the bottom of the lawn.
Okay.
I feel better now, except my head is absolutely throbbing.
I bet it is. You've had a decent bump, haven't you? Will you check her pupils, please, Vic? Thanks.
Just check your eyes.
Oh, I think they're all right.
Yeah. Let's hope so. You just look at the end of my nose for me.
You can't miss it.
Don't you laugh. It's not that big, is it? Mum says I've got a button nose. Lovely. They're fine. Freezing.
So everything we've done, Jennifer, is perfectly fine. However, my only concern is because you think you knocked yourself out. That's my only concern. So I would always recommend popping up the hospital. However, I don't know what they'd probably just keep an eye on you for a few hours, and then if everything was okay, they'd leave you be. Jesus, I thought that was a person then. I was just scared the life out of me. That has.
What's your dog's name?
Bitsy, look at her. It says, I've seen you people come before and take my mum away.
Oh, love her.
Do you want to let her in?
You let her in if you want.
Do you want to get her in?
You can if you
Yeah.
like it.
Is it just this door here?
Through the kitchen and...
We'll let her in, sweet. Come on then. Hello. Hello.
I'm all right.
Hello.
Come on. Good girl.
So would you like to come to hospital? Is anyone sticking... What are you getting upset for, sweet? Oh, bless you.
Don't get upset.
I don't feel like you need to go. The only reason I'd say that was because you thought you knocked yourself out. However, if there's someone around who can just keep an eye on her for a few hours, all right? And if anything does change then, you can either get yourself up there or you can call us back and we'll take you in then.
Satisfied that Jennifer won't be left alone, the crew head off.
Done. Right. You take care of yourself, all right? All right, sweet.
You take care. All right. Bye. No
See ya. Oh, Jennifer's dog was lovely, wasn't it?
Yeah, it was cute. Got a cute little face. I'd like a dog. They're not usually that well behaved, are they?
Mine's a nightmare.
Yeah, yours is.
He is a nightmare. Bless her, she had a good bang to the head as well.
That was a good bruise to her head.
Yeah. She'll be all right. Looked like she got good family support as well, so at least she's not on her own.
Satnam, whose persistent cough so hindered his breathing, was admitted to the hospital's critical care ward and put on a ventilator. 3 days later, he was discharged home with new inhalers. Although these have helped, his cough remains and investigations continue. Brian, who fell from a stepladder while cutting the hedge, had a lucky escape. X-rays showed no broken bones and he was sent home from hospital the same day. 83-year-old Thomas was running a high temperature after an operation to remove part of his lung. He was kept in hospital overnight and given antibiotics to fight the infection. He's now back home and recovering well. After a series of tests, Heather's heart was given the all clear. The pain in her chest was put down to a pulled muscle, not helped by indigestion. She's now feeling much better. Jennifer stayed at home after bumping her head when she fell in the garden. She didn't need to call the ambulance crew again and soon felt back to normal.
Woo! Game over. Game over.